Alright, so we're going to do a dry needling technique now for the gastrocnemius. Now this is an area of the body that I personally find responds really well to dry needling, and I use it quite often with clients that present with hypertonicity or tension through that posterior lower leg, limiting ankle range of motion and just basically interrupting the quality of their movement. And so what we're going to do here is firstly consider where our neurovascular structures are that we have to be aware of. The popliteal artery, which runs centrally down through the back of the knee here, sits very deep. It's almost the deepest structure next to popliteus in the back of the knee. So it's sitting quite deep through those structures. Now it does come down and branch out as it passes behind that popliteal crease into this lower leg, but it stays fairly central in this top part. So when we're needling through the gastrocnemius, we need to be aware of the fact that we want to stay away from the central line into those lateral and medial heads specifically. A lot of people make the mistake of needling obliquely at sort of an angle into to each of these heads, which is fine in most cases if you're using a shallow needle, but if you do go too deep, you will put that needle pretty close to the popliteal artery, which isn't of major concern, but if we can avoid bruising the person and potentially injuring or puncturing that artery, that'd be a great thing, of course. So we want to stay away from those structures. So what we're going to do here is, using our swab just to prepare the area for a start, I'm going to put one needle into the medial head and one needle into the lateral head, just to give you an idea of angles. Now we've got a few different angles that we can play with, but probably the safest one for a start would be look at that central line, move lateral away from it, use your palpation, identify the location of the trigger point as required. We then place the needle in position. I'm going to insert it perpendicular basically to the table, so heading down through that lateral head, staying away from that midline, away from the central point of that leg where we find our popliteal artery. So we often find these trigger points clustered up high in this lateral head and even in the medial head. And so using your assessment, as I said before, identify the correct location, and then you can aim directly at those points in a perpendicular direction. Medial head, same kind of concept, placing the needle onto the skin, and then we're going to insert it directly down towards the table. Okay, using that angle will be well and truly safe. If you have any concern whatsoever, obviously the guide with any needling technique is to go slowly, look for feedback from the client, make sure that they are open to giving you feedback and just say, let me know how it's feeling as we go. If there's any discomfort, they can tell you, you can stop, you can withdraw the needle, change angle as needed. But in most cases, you'll find that using that angle, that approach with the gastrocnemius, you'll have no issue whatsoever.